Dear learners, today's MOOC will be on meaning of gender, gender and health from the module 5, Gender and Health. Myself, Rajmi Mahanta, Assistant Professor, Department of Sociology, KK Hendick State Open University. Let us start with the first topic, that is meaning of gender. Gender refers to socially and culturally constructed masculine and feminine characteristics that are attributed to biological male and female. Along with it, gender also refers to a range of other identities that do not correspond to the established ideas of male and female. People often use the term gender and sex interchangeably. However, that is not correct. Sex refers to the biological, physical differences, while gender is how people identify themselves. Sex refers to the physical differences between people who are male, female, or intersex. A person typically has their sex assigned at birth based on the physiological characteristics, including their genitalia and chromosome composition. The assigned sex is known as natal sex. Unlike sex, gender is a broad spectrum and not limited to the natal sex only. And there is another great misconception, that is, gender is equated to women and women's issues. But gender is much more than just that. It is how a person identifies themselves. They may conform to the natal sex or to the gender spectrum, or may be completely outside of it. Those who identify themselves outside the natal sex may be included in the identities of transgender, non-binary, or gender neutral. According to World Health Organization, gender is defined as a personal conception of oneself as male, female, both or neither. We are going to discuss the next subtopic under this, that is aspects of gender. In the past, gender has been looked into two aspects, the masculine and the feminine. The masculine is generally associated with men, while feminine is associated with women. But in the present, the term gender is used more inclusively, as it also includes the third gender, who are categorized as neither men nor women by society. They are more commonly known as the intersex people. The next subtopic under this is the social construction of gender and gender inequality. Gender, like other identities, is socially constructed. Gender norms, that is the socially acceptable way of acting out gender, is learned from birth through childhood socialization. Historically speaking, men have been considered superior to women in almost all societies. As such, the masculine has been seen as more powerful compared to feminine. Men's work is considered more valuable than work that women do. The third gender has been further marginalized under it. Women have less land, wealth and property in almost all societies, but more burden of work. Girls in some contexts are fed less, educated less, and more physically restricted. Women are mostly employed in lower paid jobs. Gender hierarchy governs how human behavior operates. According to European Institute of Gender Equality, legal, social, and cultural situation in which sex and/or gender determine different rights and dignity for women and men, which are reflected in their unequal access to or enjoyment of rights, as well as the assumption of stereotyped social and cultural roles. There are three main inequalities which are found, and they are found in workplace, educational systems, and health. Promoting gender equity and empowerment of women is the third goal of Millennium Development Goals. Moving on to our next topic, that is gender and health. Since men are seen as more important in most societies, their health is considered more important than women's. Therefore, within families and in unequal societies, men seek more health care than women. relationship between gender and health. One's gender impacts their health conditions. One's health relations reflect the differences that exist between the genders. Now let us look into two important definitions. The first one is given by Universal Declaration of Human Rights. The Article 25 of UDHR states that everyone has the right to standard of adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care and necessary social services, and a right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control. The second definition is given by the Department of Gender, Women, World Health Organization. The WHO created a Women's Health Unit which in 2000 evolved into Department of Gender, Women and Health. The department advocates for a global gender equality in health for women and men. Since the biological and socio-cultural factors affect women and more men differently, the department aims to increase knowledge and strengthen the health sector response by gathering evidences, developing norms and standards for mainstreaming gender in health policies, and advocating how gender inequality affects health. The subtopic that we are going to discuss under this topic is socio-cultural factors that affect health. There are many factors that influence health. We call them as determinants of health. The first determinant is our gene or biology. The second one is the behavior of the individual that includes bad habits like smoking, good habits like exercising and eating balanced diet. We are now going to discuss about the third determinant. Mostly it is assumed that health is a result of these genes or their own behavior, but it is the physical and social environment that have a big impact on our health. These aspects are called social determinants of health. Social determinants are the conditions in which we live, we learn, we work and we play. Therefore, these conditions influence our health and also the health of the community as a whole. Social determinants includes the level of education, exposure to violence, the way one's community is designed, and access to healthcare. In the further slides, we are going to discuss everything one by one. These determinants are also the reason for inequalities between men and women. It is said that health inequalities are natural because of the biological differences between the two, but this is a misunderstanding and it needs to be corrected. Social and cultural factors influence biological aspects. Number 1, education. Education gives us the tool to make good decisions about our health. It gives the opportunity to participate in healthy activities and see a health professional regularly. In our society, men has the access because of the preference given to them. Their education is given the first priority, while for women, it is seen as optional and negligible. Therefore, they have to rely on others for access to the most basic healthcare facilities. The second one is income. People with higher income have more access to health, safe neighborhoods, access to grocery stores and healthy foods. Although both men and women are prone to low income and poverty, poor housing, little to no accessibility to doctors and basic healthcare and insurance, the suffering of women is a bit more because of the gender pay gap. Gender pay gap means the average difference between wages of working men and women. The women are lesser paid ones. Women who are without any source of income has to rely on the male counterparts in her family. The third one is community mindset. The society and the community we live in gives us certain roles, expects outcomes from them, and sets certain standards for us. Health and beauty standards are such things. Beauty standards are a set of values applied to both men and women to be regarded as handsome and beautiful in order to fit in the community. They are concerned with their hair, skin color, clothing, etc. It differs from culture to culture and community to community. For instance, healthier women in some parts of Africa is considered physically desirable, whereas in most parts of the West, thinner women are considered physically attractive. We will discuss about such socially constructed standards in details in the upcoming classes. Now let's proceed to the last determinant. Number 4, access to healthcare. Access to healthcare is determined by how frequently we are able to receive medical help, if we have health insurance, if we can afford treatment, etc. Let us look at why access to healthcare is a socio-cultural determinant for men and women. Men hesitate to ask for healthcare. Due to their conditioning and stereotypes, men are not expected to cry, complain, and be strong all the time. This is the reason why males hesitate to seek help and struggle with mental health issues themselves. Women are treated unfairly in access to healthcare. Gender inequalities of health originate in the traditional society where definitions of health status and traditional medical practices all reflect the subordinate status of women. Gender inequalities in health include emphasis on excessive childbearing roles, discrimination against female children in health and general care, hazardous workspace, lack of autonomy, early marriage, etc. Now we are going to discuss our third topic, that is type of health issues. It is generally considered that men are stronger since they are bigger, muscular, and mentally much more competent than women. But in medical terms, it is a different case. It is observed that decade after decade, women's longevity has outspaced men. But then again, even though women live longer compared to men in most countries, they have more age-related disabilities. With an aging population, the risk of chronic diseases such as diabetes and mental health problems such as dementia, Alzheimer's disease, and depression has been amplified among women. Moreover, some diseases such as breast cancer, osteoporosis, and eating disorders are more common in women, while others such as endometriosis and cervical cancer affect women exclusively. Now we are going to look into the physical health issues affecting women specifically. Other than heart-related issues, stroke, diabetes, etc., that affects male and females alike, let us discuss some of the specific issues in detail. Number 1, maternal health issues. From iron deficiency, anemia to high blood pressure, the changes a women experience during pregnancy can impact women's health. Number 2, urinary tract infections. It occurs when germs get into urethra and start to multiply. It affects women more than men. Symptoms of UTI include frequent urination, pain or burning when urinating, cloudy urine, etc. The third is cervical cancer. It is a malignant tumor at the cervix, the lowermost part of the uterus. Sometimes symptoms include bleeding in between periods or after sexual intercourse, foul-smelling discharge, low back pain, or abdominal pain. Sometimes symptoms may not be even there. Number 4, osteoporosis. It is a disease that causes bones to weaken, making them prone to fractures. Postmenopausal women are at the high risk, along with women with certain medications, early menopause, low body mass index, cancer treatment, and genetics. The next one is breast cancer. It occurs when some breast cells begin to grow abnormally. There are different types of breast cancers. The treatment depends on the stage of cancer. It may consist of chemotherapy, radiation, hormone therapy, and surgery. The last one is Alzheimer's disease. It is a form of brain degeneration in which abnormal particles called neurofibrillary tangles and plaques form in the brain and destroy healthy brain cells. It is a form of progressive disease that destroys memory and other important mental functions. Women are nearly twice as likely as men to develop Alzheimer's and live longer after the diagnosis. Next, we are going to discuss about the physical health issues that affects men specifically. Men are more likely to suffer from lung and colorectal cancers, heart diseases, and traffic accidents. Some diseases such as prostate cancer affect men solely. Prostate cancer develops when abnormal cells grow in the prostate gland. It is a common type of cancer in males. Difficulty or frequency in urination, presence of blood, and pain are the earliest warning signs. Other than that, Alport syndrome, male pattern baldness, SRY, sex determination are some male-specific diseases. Some other diseases that are more likely to affect men than women includes Parkinson's disease, autism, melanoma, which is a type of skin cancer, pancreatic cancer, gout, a type of arthritis caused by excess uric acid, kidney stones, etc. Now we are going to discuss about the mental health issues which affects men and women. In many cases, sex and gender interact to contribute to create certain health risks. For example, women's high risk of depression is influenced by genetics and hormones, but gender plays an instrumental role in magnifying the relative risk. First, we are going to discuss about the mental health issues in women. Women who have non-communicable diseases like diabetes and polycystic ovarian syndrome are more likely to suffer from depression, as these diseases are associated with gaining weight and suffering from fertility issues. This can lead to low self-esteem and feeling undesirable. Menopause and pregnancy can also contribute to depression. In men, society's expectations and traditional gender roles play in why men are less likely to discuss or seek help for their mental health problems. According to some research, men who can't speak openly about their emotions may be less able to recognize symptoms of mental health problems affecting them and less likely to reach out for support. Mental health problems linked to puberty, like identity crisis, are common amongst boys. Depression among men can be seen in the form of irritability, sudden anger, increased loss of control, risk-taking, and aggression. As coping mechanisms, men are more likely to use alcohol and drugs. High rates of suicide is also common among males. Now, let's sum up the key topics that we have discussed so far. We began with the meaning of gender, difference between sex and gender, and aspects of gender. Then we moved on to the next topic, where we have discussed about gender and health, socio-economic factors that determine health. And lastly, we discussed about the types of health issues, physical and mental, that affects women and men. With this, we have reached the conclusion of today's class. Thank you.